We are now going to start with our second panel, which is going to be our return to sports and sports performance panel. Our speakers are going to be Dr. Cal Adams, Coach Kytwan Heath, and Coach Chris Gores. Give them a round of applause. First question is going to be, how do you define return to sport from a clinical perspective, and what factors do you consider in deciding the athlete is ready?
Yeah, it's a great question. I guess we'll kind of stick to the ACL, mode here. So return to sport for us is typically, we have that discussion day one. I'm lucky being a clinician, PT as well. So it definitely starts day one with the timeline. But typically, month 2, 3, our athletes can start to get back in the training room, start to get after their lifts a little bit. And then, like Dr. O said, typically ACL-wise, 9 to 12 months. I would say I will cautiously recommend closer to 12 with our athletes. I think we see that in the literature. Just because Adrian Peterson did it, 10 years ago, doesn't mean that you're going to do it. You're 6'2", 148 pounds, playing wide receiver, so you might not be back in 9 months. But yeah, we use, we have a lot of tests on the clinical side of things, a lot of hop testing, which is, everyone has their opinion on. We use that same battery, vertical testing. We use a company called Vault with force plates. And we probably put more stock in how an athlete looks with their strength and conditioning work, with their cutting. We definitely like to look at single leg and double leg, counterbalance jumps on our force plates. We might look at how quickly they're getting off the ground and landing. And then honestly, outside of that, it's, coaches and PTs in that continuum, it really just comes down to how that athlete looks as we around 8, 9 months are definitely taking them from, very block practice and they know exactly what they need to do with their cutting work. And then as they transition into more random work and basically like as things get sketchier, if they look good, we feel pretty good about it typically. But it's definitely our job to make things a little sketchy for athletes as they get back to playing.
We'll make things easy. We need to go with you, Chris, and then we'll go with each one. We'll just go with the order.
So same question?
Yeah, same question.
Yeah, got it. Okay, so yeah, returning to sport, I think obviously it starts with the athlete, and then where was that athlete before the injury, and then what sport are they returning to as well, right? Are they returning to soccer and football, or are they returning to pickleball? Those are different things. So being able to take that all into account, and then as somebody referred to earlier, for a runner, they identify as runners. For some of these athletes, they identify as athletes, and to take that away from them for such a long time, that can help, or that helps increase their anxiety and their stress, because their self-confidence comes from a source of, hey, I'm out there on the field doing the things that I love to do, and that's where I gain my confidence and self-esteem from. So to take that away for such an extended period of time, we are also considering that mental health aspect of that. If we can get you to return to sport or some aspect of that sport, or at least making you feel like we're doing everything that we can to get you there, that can help at least reduce that mental stress that so many of our young athletes, especially our young female patients and athletes that gain confidence through sport, that's such a huge part that we want to be able to give to them as soon as we can. Yeah.
Well, for me, and what I do with my athletes, I have to communicate back and forth with guys like Chris. You don't know how many times I had to call Dr. O and be like, hey, man, what you think about this athlete coming back off of whether it's surgery, any type of injury? Because I deal with parents, and sometimes parents want the athletes to be able to perform right away, and that might not be the best solution for the athlete. So I might have to call Dr. O and be like, hey, man, give me the real deal on this player. How much can, workouts can I do with them in a week, or what's the load look like for an athlete after getting back from whatever type of injury they had? So that's what I have to do. I have to communicate with guys like them. So
One more thing I wanted to add, and I forgot to say this earlier, we also have to calculate the risk reward right? Like what are we risking? What is the reward? So if it's a relatively high risk, but the reward is different, because if you're an athlete and the World Cup is in 6 months, yeah, this is completely insane. We shouldn't do this. And we have to have this conversation. What you're asking to do is completely insane. It's unreasonable. It's unfair. But the World Cup is in 6 months. They're not going to move this for your injury. Right. Do you want to do this? If you want to, this is what it needs to be. Now we have to have that conversation with them and realize that, hey, look, what you're doing is stupid, but like, I get it. It's the World Cup, right? So there are those things. There are those conversations. Whereas we just had a conversation the other night for somebody who wanted to return to a high school football game, and it was like, does this high school football game, is this high school football game worth risking the rest of your life, like not being able to walk correctly, right? So those are some things that we have to consider.
Response. Question 2, going back to you, Dr. Adams. Can you discuss the role of rehabilitation and physical therapy in restoring full athletic performance after an injury?
Yeah, I mean, let's hope it's important. That's what we do every day. I think that's pretty obvious. And I think, setting that timeline and, I think to echo the PTs earlier, what we are doing in terms of establishing rapport during the process of coming back is absolutely paramount. I think we're, lucky enough up here that we work with our athletes in a very context specific way, right? They're in the weight room with us. They're on the field doing technical work with us. And that's where the money's made in the process. So early on in the process, the PT is relatively straightforward. In the case of ACLs, right, like Dr. O alluded to, we've got to get the quad as big and strong as possible. We've got to support it with everything around it. We've still got to get really robust with cardiovascular systems and conditioning. And that all starts in that early phase in the clinic. And then most importantly, you really see when those athletes start to get back into the strength and conditioning phase of their program, they start to become themselves again, typically. When they start to be able to get back to our technical coaches and our speed coaches, and they're finally working on that first step and work time and 10-yard flies and all that stuff, that's when they can get with their teammates for the first time, oftentimes. And then that's what really establishes that, like, all right, I'm actually getting close to this process here, and at a point where I feel like myself, because at the end of the day, our athletes, they can have hobbies and we want to encourage all that, but they're going to identify with themselves as an athlete first, and they're going to identify with their teammates as kind of brothers and sisters at the end of the day. So yeah, it's super crucial, but I think the later stages of something like an ACL is where things get pretty fun for us.
Sorry, Lee, can you repeat that question?
No problem.
Yeah.
Go back to areas. Can you discuss the role of rehabilitation and physical therapy in restoring full athletic performance after an injury?
Got it. So just for clarification, I am not a physical therapist. We are lucky enough to have somebody that does the physical therapy on our staff, and we are integrating that into it. I'm a strength and conditioning coach, performance coach, speed coach. I do believe that it is my job and it is my role to understand the physical therapy world, so that when I am speaking to physical therapists, I know what the contraindications are. I know what phase of the rehab that we're in, and we can create a seamless environment for the athletes so that it doesn't feel like they're having to re-log into the system every single time that they have a new practitioner that they're working with. So for me, there's just a lot of communication with the surgeons like Dr. O, physical therapists like Kyle or like Lance, and to make sure that, hey, like we're good to push here, or hey, we need to be a little bit more cautious about where we are and how far we're able to push or work through pain and anxiety. And as Kyle said, once you do get to the second, third, fourth month, and we get people around their teammates and things, it does get a little bit tricky because they're going to feel great and they're supposed to, and we still have to wait a little bit because there's just such a big difference between being in a controlled environment in a workout where we want them and everything is predictable and we want them to push themselves, versus you get out there in a competitive environment, especially in a soccer game or something like that, where anything could happen, right? So we do as much as we can to train not just the physiological side, but also the mental side of being able to perform in that field or in that sport with high IQ. We talk about game IQ a lot. If you don't know where the hits are coming from, then you're going to be more vulnerable to those hits. So to be able to predict the game that you're playing, that's a huge component of our physical therapy in our training.
Yeah, I'm gonna piggyback a little bit what Chris said. For me and what I do, PT is so key in the process of a player getting back from injury. There's been plenty of times I done sat in Onyx and watched Lance help a player get his confidence back, mental confidence back, and help him prepare from whatever injury the athlete has had. Then someone like me can come in and communicate with Lance and see, the progression of an athlete. So it's key for me to know what's going on with that athlete by the time he come to me. So I think PT is real clutch and when the athlete is coming back from an injury.
Okay, good job, guys. Again, I'm gonna go back to you, Dr. Adams. How do you balance the need for rest and recovery with the athlete's desire to return to competition as quickly as possible?
Yeah, absolutely. That can be a little bit of a tricky situation nowadays. We kind of know in the structure of American sport. I was a soccer guy growing up in the essentially academy system, and that gets pretty tricky in that world. So balancing what your high school expects from you, what your club expects from you, parents still trying to be a student, all of that gets tricky, and looking at how we recover, I think becomes, paramount. Like as an example, we definitely have a pretty heavy baseball niche in our practice, and one of our guys is a committed senior, undersized, like 5'8" kid, 91 miles an hour, right-hander, all that sounds good. And he said, hey, look, he threw 56 innings in his high school season. He threw, I believe, like 21 during the summer, which is pretty heavy. He was going to shut it down for 3 weeks and then likely take the fall off. And then there is an organization that has a showcase in town for pro prospects.
Yep.
And like, hey, do you think I should ramp up? Like our evidence clearly shows typically we need to double our shutdown time to ramp up time. 6 weeks, he wants to come back in 3. The workload doesn't make sense. And it's having a conversation with him and he, look, like this is like my son at this point. Like, dude, you're 91.
Right.
Like no one's getting excited about 91 in the game in today's baseball. Like unless you're 95 plus, and you're going to have to prove that in the spring. So like all of our research shows that you're about to make a bad decision and there's no risk reward, just like Chris said. So like in that risk reward scenario, what's the upside there? And I think that just goes back to like athletes' mindset nowadays and how they're looking at potential rest and recovery. If something big's coming up, they understand they need to recover from that. But outside of that, I mean, they'll be idiots and push the ticket as far as they can just because they want to prove at every single situation presented to them that, they are he or she as it comes down to, being that top performer, unfortunately, I guess.
Yeah. So rest and recovery is really what separates an elite professional level athlete from a novice athlete that just says they want to be there. Because the rest and recovery stuff is the stuff that happens the other 22 hours of the day that you're not working out, right? And a lot of people think it's going to be the workouts that you do, what speed training that you do, what special devices that you buy, but really rest and recovery is going to come down to, do you sleep 8 hours a night every single night? Do you eat the right foods, and are you replenishing with the right amount of protein in your nutrition plan? If you're doing those things from a daily perspective, then you're giving yourself the best chance to perform at a high level. And I think like studies have shown that if you are sleeping your 8 hours every single night, that benefit is almost equal to performance enhancing drugs. right? So if we know that PEDs are illegal because they give you such a huge advantage, why wouldn't we do something that's equivalent to that type of advantage by just sleeping every single night? So a lot of that is just getting guys off of TikTok, getting them off of Snapchat late at night, go to bed, put your phone away. So that's the daily habit. And then going into the yearly habits that like Kyle was talking about, unfortunately, because of the landscape of American youth sports, we do have to treat this like a business. And when people come to us, we treat them like a business. And it's like, unfortunately, all the things that you hear in youth sports that we grew up with, sacrificing for the team and doing all this and that, like, that's kind of out the window when you're talking about a kid who's trying to get recruited because I throw 91, but I need to throw 95, or I'm an athlete that like I need to get a Division I offer, all those other things. Like, now you have to treat yourself like a business. So like, what's the best for you? And what's best for you might not be playing at every AAU tournament ever. All right. So sometimes saying no to tournaments and saying, hey, I'd rather rest for the next month than go out there and play crappy basketball because I'm tired. All right. So some of those conversations are tough to have because they want to be able to compare themselves, and like the biggest post that a kid wants to post, and it's not even just the kid, the families want to post the blessed to receive an offer post.
Yes.
Right?
Oh.
Like, everybody wants that post. Everybody wants to say, oh my God, I got an offer. One, that offer isn't real. You're 14 years old. It's not even allowed yet. Right? Two, like, you can't take a million offers. You can only take one. So like to have those conversations with those kids and let them know, like, hey, like, if this is what you want to do, this is what you want to play, this is what it's going to take. And like, don't worry about all the social media stuff. Like, so much of our recovery tactics is just getting them away from the things that are distracting them from what really matters. Yeah.
Yeah, so for me, rest and recovery, when I think about that, I think about long-term high performing, right? For a long period of time. That's the first thing that come to my mind. And I'm still learning as well. Over the summer, it was fortunate I had a chance to travel with Chris right here, and we went to one of the biggest sports performance places in the country. And to see what an all-pro NFL player look like and how his work day is, and then how he takes recovery. And then the next day is early in the morning, 100 degrees, and he back out there performing like back-to-back days, like pushing his body through the limit. And for me, for you to be able to perform like that, you have to have the right recovery program, sort of like. So for me to see that over the summer and see all pros and the way and how serious they take recovery, it was just a big help for me. And to get the information and pass the information on to high school guys, college guys. Well, college guys is pretty much they doing it, because I have a son now and he didn't used to take recovery serious. All he knew was work. But now he's at Virginia Tech, and that's one of the things that they stress. Like, we're going to take recovery to a whole nother level. And then nowadays, with the way technology is, some of the hyperbaric chambers and like, it's just to a whole nother level, so you can perform long term. So I think it's just very key and important.
Okay, this question before, I'm gonna start with Chris. What are the key physical and psychological hurdles athletes face when returning to sports after a serious injury?
So that's going to change from athlete to athlete. Obviously, there are some athletes who are gung-ho about the recovery process, that rehab process, and they want to do as much as they can as early as they can. There are some athletes who are very timid about it, and they're very scared because what they just went through was probably the most painful thing that they've ever done in their life. So they don't want to go through that again. So every set that they take is an anxious one. So, for those athletes, I think you have to bring joy back into their training, because you're really either in a state of joy or fear. Like that's kind of how your nervous system works, at least when we're trying to introduce things to you, right? And for you to learn and capture or recapture new information and relearn how to move and walk and run and jump, if you're not in a state of joy, if you're in a state of fear, then your body's just going to protect itself, and it's not going to allow itself to learn or relearn those movement patterns. So a lot of the things that we do from a psychological standpoint is we just try to make things fun. Like one of the big hurdles is running again. So for somebody who went through an ACL surgery, they're very anxious about it, and if they're worried about running again, we'll play a game. Like I've actually like done like the balloon juggle. Like, hey, we're just gonna juggle these balloons, keep these balloons off the ground, and now they're running without ever thinking about it, right? Because we were able to remove that anxiety, that barrier to the activity, and then they're like, oh my God, I just ran. Right. So to help that type of athlete, that's somebody that we need to bring into a state of joy. And then for the ones who are just always pushing themselves, we do have to kind of go back to that conversation that we just had, which is the rest and recovery stuff. Like, hey, your adaptations don't happen during the workout. Your adaptations happen at rest. So the better that we rest, the better that we recover, the more you're going to get out of these workouts, because what we're doing to you now in our gym is actually breaking you down, right? The building back up period happens when you go to sleep tonight. Yeah.
Yeah, I think that's great. I think too, identifying who that athlete is and what's important to them. Like we're going to work with a spectrum. So, if you want to play at the Division I level, and beyond, the bottom line is like, I would say that we set the table where we don't allow a lot of, really downtime for that athlete, and we also don't allow them to be very like lackadaisical with their preparation. So we're just honest with them and say, look, from your recovery, from your physical work, whether that's speed work, whether that's training in the gym, you've got to be here. Consistency, is the king at the end of the day. And if this is what you want in the future, this is what we are going to expect from you right from the jump every single session. Psychologically as well, it goes hand in hand. And if they struggle with that, those are the athletes that you have to get to mental health professional. To get to like the mental side of things. We can expose them, and we can give them surveys that clearly show us that they're struggling with that, but that's not our wheelhouse, just like it's not our wheelhouse like technical coaches. But on the flip side of it too, I think it's also really good to identify early on, like if you have the athlete that wants to be a really good senior in high school and they want to be the best they can and make an all-region team, if they just want to honestly come off the bench when they're getting smoked by somebody and contribute because that's their friend group, that's great. I think setting the table for them looks very different, and that's where like the fun piece can be even more important for them because it sort of isn't a job for them at the end of the day. And I'm okay telling our elite athletes like, this is your job. If that's what they want, we can help them with that. But, we work with a number of athletes that maybe 10% of our folks they just want to be the best they can and be healthy and get back to doing what they enjoy by the time they're, 18, and then they're going to go to Alabama and, join a sorority and have fun. And that's cool too. And typically they're the easier ones to deal with, I would say, on the psychological side of things, because they know how to have fun. So.
Once again, for me, I'm gonna go with a more personal approach on this question right here. My son, he actually suffered a pretty bad injury one of his high school years, and I had to be more mental support more than ever during this time with him. So he treated his situation a little bit different. So I had to take a more different approach because I'm always trainer, always been pushing him from a very early age, and I had to take a step back because he was mentally going through it a rough period of time. So I was like, I had to take a step back as a trainer, as a coach, and be more of a dad support during this time of injury. And I think that was real key that he's seen that, and that would kind of help him pretty much start his engine back up to want to get back to playing, get back to going. And once he seen that was real crucial and helpful in his process of getting back to playing. So that was key.
Okay, Kytwan, I'm gonna start with you with the next question. It's actually question number 5. How do performance metrics such as strength, agility, endurance influence the timing of athletes' return to sport?
Oh, say that again now.
Okay, no problem. How do performance metrics such as strength, agility, endurance influence the timing of an athlete's return to sport? And if not, you may want to start with Chris.
Yeah, let me start. Let me start with the.
Okay. So all of these metrics are crucial to advancing somebody from one stage to another. And there are stages that are locked in, especially early on in the surgery or early on post surgery. There are stages that are locked in that you just can't mess with. We call this the no-fly zone. Like this is the hard deck. Do not mess with this stage right now. And then once you get out of those stages, we have to be more than just a calendar, right? Because if we're just going to say, hey, 9 months, 12 months, yes, that's for sure the standard. But you're coming here because you want our expertise, you want our eyes, you want our knowledge, you want our experience. You don't need me if you're just going to look at a calendar for your rehab. So that's when those performance metrics matter, because we're measuring your strength, we're measuring the trends in that strength. So it's not so much about a point of data in space. It's more about measuring that trend. Is it trending the right way? Are we getting stronger? Are we getting faster? Are we getting more symmetrical, and gaining confidence with that? And then every phase then is we graduate to the next phase based off of that criteria, not just the calendar. So I'm not saying that the calendar doesn't matter, but you have to blend that with what's going on, because it could also be the opposite way, because the calendar might tell you, hey, patient should be ready to start jumping now. But when you look at the performance metrics, they're not ready for that, right? So we have to be just more than a calendar, and those performance metrics help us do that.
Dr. Adams.
Yeah, agreed. I mean, so I'm a Virginia Tech guy fan. Like, there's another receiver that just came back at 8 months, and I think it works both ways. Like, whatever he has done behind the scenes, right? Like, it probably passed some metrics that showed us that he could at least get back on the field. I mean, we look at some stuff like 90+% side-to-side quad strength, hamstring strength, single leg jump. Those are the performance metrics that we like. But yeah, whether it's 4 or 5 months that we get to some of that stuff, whether that's 9 to 10 months sometimes, that's okay. Athletes just have to be okay with that as well. And we have to, I think that's one thing that we've changed in the past year for us with our ACLs, is just being very clear right out of the gate that what you put in and how your body reacts. And the surgery could go perfectly well, stuff comes up. I know one of our athletes just got extremely sick for a week, out of her control, and now she's got 5 degrees missing from getting straight. It's going to be a tough little road back. So, yeah, I think all that stuff is really important. I think the agility piece is the hard piece to solve, because we really have no data that shows that passing like a T-test or a 5.10.5 is going to get you back. So I think that's where we have to rely either ourselves as performance coaches or like our agility speed coaches. It's like almost an eye test thing, and it's very helpful if you know the athlete before their injury. Like, hey, how do you feel? And yeah, I feel 95%. I'm like, well, you look terrible. Like I got you at like 64. And they're like, no, yeah, I know. Like, yeah, actually I'm nowhere close. So, we see it all the time just because athletes lie to us every day. And it's a fun part of the process. But yeah, and the only other thing I would say is that we try to attack conditioning earlier and earlier every year. Because there's no reason not to get super robust with whether that's aerobic training, anaerobic training. At the appropriate stage, we try to hit it, I think, as early as we can. Yeah.
Okay.
You good? Yeah. One more thing to add, and you just brought up all those metrics, so it made me think of all the numbers that we look at and all the other stuff. I think that there's both sides. So there's the conditioning aspect, like are they able to maintain a certain level of effort, and then there's also that max effort, and that's probably the last thing that comes off of, especially like an ACL injury, after everything gets rewired and you have to relearn how to run. And then that just goes back to the sport. So this is where those measurements really come in handy, because if I know you're a wide receiver to play at the Division I level, if you can't run 20 miles per hour, you are at a severe risk of injury, because now for you to be able to even be competitive on the field, you are redlining your body all the time to run 18 miles per hour, right? Whereas somebody who can do that, then 18 miles per hour is less of an effort for them because their max speed is higher, right? So those are the things that we try to measure and compare to say, hey, like if you want to go play competitive soccer, if you look at the World Cup data from the last 3 or 4 World Cups on the women's side, every round, if you look at the average speed and the speed covered at fast speed, so over I think they say about 18 miles per hour, over 18 miles per hour, every round that they go into in the tournament, the deeper it goes, there are more runs covered at that speed. So it just shows that to be elite, you have to be able to play at this speed. So if you can't play at that speed, then you are at a risk of injury, and that's where data helps to have an athlete understand where they are and where they need to be, and also just like what they need to do to get there.
Good job, guys. Number 6, question 6. What role does collaboration between medical professionals, coaches, and trainers play in ensuring a safe and effective return to sport?
So
It's number one.
Okay.
Number one, to me, and I mean, today's a good example of that, I think. I can speak for PTs in the past. Like sometimes it was a struggle to get maybe your orthopedist to be on the same page and to be open and communicate. And that's obviously getting drastically different with the younger group of surgeons coming out, which is very helpful for us. Because sometimes it's a little siloing at times. And I think we have historically done a really bad job as PTs of also like working with our strength and conditioning professionals as well, right? Because I think it's just the way that professionalism, the different bubbles have worked over time, it's kind of been this disconnected piece. Whereas nowadays with like modern approach to stuff, it's very much, look, I'm going to go see my surgeon today. Hey, I'm going to see my PT. PT's been in contact with surgeon. I started my strength and conditioning program. My strength coach knows that I'm let's say I'm 3.5 months post-op ACL. I'm doing really well. And we were on the treadmill for the first time last week. So I can go ahead and hit this stuff in my new program next week. And when everyone's on the same page, it's really good. It's really frustrating, I think, for probably all of us. I'm lucky enough to wear 2 hats, but if you don't know what's happening, or like if you're somebody's speed coach and your athlete is like, hey, what do you think about retesting the T-test today? And you're like 7 months out and you're like, I don't know, have you done it? Should you wear your brace? Should you not wear your brace? So there's lots of questions that come up. And I think when everyone's on the same page, it's pretty seamless. Because, for us, whether it's liability or not, too, like if our athlete gets hurt again, that's what keeps me up at night. I don't care that my athlete went and played, was on TV last night, and did well. We expect that. It's our 17-year-old, girl that did something she wasn't supposed to and retore ACL, and I mean, that'll tear you up for months. So, yeah.
yeah, absolutely. I mean, even the injuries that you can't help because injuries just happen. There's no way to bulletproof an athlete. Even those keep you up at night. So the ones where there could have been things that would have prevented that injury or prevented a re-tear, for instance, those are the ones that make you absolutely sick. So communication is the number one thing. I have to agree with Kyle here. Like there's nothing more important than communication across everybody involved. And that return to play process has to have the parents, the coaches, the ADs, the surgeon, the physical therapist, the strength and conditioning coach, the skills coach. Everybody has got to be in constant communication, right? Like we've all had that service call, or we call our bank, or we call our phone company, and we have to give our information, and then they transfer the call, and then we have to give our information again, and they transfer the call back, and then we have to give our, like, that's so frustrating. So for our athletes to be able to create that seamless environment helps them know that they're in good hands. And that gives them the confidence that, okay, I can push when they tell me to push, when they tell me to sit down and stop, I'm going to sit down and stop because I trust the people involved. Versus if there's not communication, then they don't know who to trust. They're going to listen to me telling them to do this. They're going to listen to their coach telling them to do this. And they're going to listen to their parents telling them to do this. And then they're going to listen to their friend who also had that injury 3 years ago. Well, this is what I did.
Yep.
And you're like, oh my God, what? So to get everybody on the same page, that's the most important thing.
Yeah, I agree with these guys. Like I was saying earlier, that's the main key. For me, that's the main key when an athlete is coming back off of any type of injury. Like I said, for a quick example, um, it was a guy that I sent to Dr. O to have surgery on the off season. He had shoulder surgery on both shoulders, and you know, great kid, just anxious to get back into it pretty fast. And I was like, um, so he was hitting me up. Young man was hitting me up for a lot of training, just wanted, searching, going hard for that scholarship. And to me, he's more important for me to know what's going on with him than just him or his parents coming to me. So I had to call. I had to call Dr. O. I said, hey, man, so what do you think about this? And I'm kind of glad that I did because Dr. O said, hey, man, look, he's ready for any type of running, lateral movement. He's good with all that, but I wouldn't suggest any passes being thrown to him because that's the risk of re-injuring his injury. So if I hadn't called him, I probably wouldn't have known that. I probably wouldn't have had no idea of that, and I would have been out there throwing this kid passes, getting him ready for the season. So that was so key for me and how the concern of my players for me to be able to call him and get that vital information so I can hold him back until Dr. O say, hey, he's clear, he 100% clear, he's ready to go work. And that was key for me. So I think that's, like they said, that's the main thing is communication. And I'm glad I'm able to have people in my corner that I can call and communicate this process with.
Okay, good job, guys. Last question. How can advances in sports science help? I'm sorry, let me start over. How can advances in sports science and technology help athletes return to sport faster and more safely? You want anybody? I'll let anyone go.
It's helpful. So the technology stuff is helpful. I mean, for us in our battery, we use force plates. We use dynamometers that just kick out, the amount of force strength for somebody. We use some laser timers for sprint stuff that's maybe not as helpful in the process. And I know wearables came up. I think it can be important in terms of just, I think with a younger athlete, a serious high school athlete, pattern identification is the point of a wearable. It's not the actual data you get. It's like, I haven't slept all week. I need to sleep more. My recovery's terrible. Maybe I shouldn't go out with my friends. I should just go to sleep tonight. So, I mean, it has its place, but at the same time, honestly, it's like, I know the guy from the Lions was here a few years ago at Jada Mayo's conference, and he was like, we got 1,800 data points from our catapult system, and we use 2 in the Lions organization. So sometimes data is a little confounding, and we're always trying to figure out, like, hey, what data is meaningful, number one, and number two isn't just kind of a flex for our athletes. Like, I mean, we've got this Proteus machine that does a bunch of stuff, and it looks cool, and it's good. But at the end of the day, is the rest of our gym set up more importantly, and it's dumbbells and barbells, and you can take that analogy across the board. I think it plays a part, but unless it tells us something that's very important or drastically important, it's probably lower on my totem pole when I compare it to just relationships and communication at the end of the day.
Yeah, I have to agree with Kyle here. Like all the bells and whistles with the technology that's coming out, whether it be Proteus or Vald or whatever 3D motion capture camera that you're going to use nowadays, I think that's just going to confirm the things that we see with our eyes. Because there's still such a huge place for us to be able to watch that movement. So what a motion capture camera is going to do is it's going to turn you into a 3D skeleton, and it's going to measure where your hips were versus where your knees were versus where your shoulders were, and was that movement biomechanically correct, right? What we have to look at in addition to that is what was that person's body language like during that movement? Was it pretty anxious? Was it confident? Was it apprehensive, right? So all of those things have to come into account in combination with the technology. But what I would say is that data does make it easier to communicate if we're talking about the communication being the number one thing. So if I have to communicate to a college strength coach across the country, hey, what's the data that we're looking at, what we're measuring, how is the progress going? That's when those things can help, because those measurements can become a little bit more irrefutable, and it's not as quite as subjective anymore.
Well, I hope I'm answering this question right. So, apparently, I'm the old head up here on the panel. But far as data and stuff go with me, and I'm a real big fan of it because I come from a time where you wasn't getting much data. You just, if you was on a bench press and you was lifting a certain amount of weight at some period of time, of course you can keep track of how stronger you get. But now when you go in facilities, they have the new technology that can track what you call it, some per power when you
PSI.
yeah, like all of that is new, and it to me, I think it's good because, like I said, I come back from old school where you can't really track none of that but a pen and a pad. So
Right.
I really like the new stuff that they got going on.
So it's funny you say that. It just made me think of something else, and maybe you come across this as well, Kyle. There are some times that we take that data and then we bury it because we don't want teams to know that stuff. Because some of that data is used against the athletes to say, "Oh, you're injury prone, you're this, you're that." So, it's a two-edged sword with this data that's out there for sure.
Yeah. I agree.
Good job, guys. I'm gonna open up questions for anyone for the panel. I'm sure somebody got one question, at least one. Okay. Well, if not, we're going to give these guys a round of applause.